Okay, so thank you for attending today's CAS meeting. This is our CAS new member orientation for new and old members, and for, of course, our friends as well. Oh, and I guess since this is a recording, I should announce that my name is Allison Del Calzo-Behrens, the chair of the CAS committee. And let's talk about what that stands for. The Community Assistance Services Committee is a subcommittee of the Morris County Continuum of Care, or COC, Executive Committee. The mission of the COC is to end homelessness in Morris County. Other communities use the term CEASE. So if you're in another county, working in another county, you might notice that their county calls this their CEASE. We used to be called a CEASE. That stands for Community Emergency Assistance Services. And each one operates differently. Some CEASES operate as part of the, through the county itself, the County Human Services. Some operate through the county's HSAC, or Human Services Advisory Council, and our CAS operates through the COC. So what is it that we do in CAS? So one of the things that we do regularly, as you've seen today, is have regular presentations from local organizations who work with at-risk or homeless populations. We discuss barriers and gaps in the housing system and propose solutions to improve that system. We do plan webinar trainings on important topics related to providing homeless services. As I mentioned earlier, we're having a webinar later this month. We review and confirm the executive committee membership. So as we are the subcommittee of the executive committee that does review the membership. It's actually a process between two committees. The nominations committee is a small committee that reviews the membership needs and vets new members and makes recommendations. And the CAS committee is actually who confirms those nominations. We make recommendations to the executive committee on standards for service provision, spending priorities, and homeless services planning. We establish, monitor, and evaluate the annual goals. We facilitate collaboration of all the COC providers. So who are CAS members? CAS members are representatives from the community, such as housing stakeholders, veteran services, aging services, youth services, LGBTQ services, law enforcement, social service providers. And I think we have many different kinds of other providers in the room as well, who interact with homeless populations in various ways. CAS members have voting rights to directly influence decision-making and recommendations. And actually the way that that works is that each agency can have up to 3 representatives that are able to vote. However, when a vote happens, each agency acts as one vote. CAS friends are people who attend meetings regularly and have a vested interest in CAS activities, but do not have voting rights. So when it comes time to vote on things like, every month we vote on the meeting summary, but sometimes we vote on other things. We've voted on youth standards before, and we've voted on, obviously, the executive committee membership. So when it comes to those kinds of votes, only CAS members can vote. What are the responsibilities of CAS members? So CAS members should be attending 75% of the meetings annually. And again, that's per member agency. So if you have 2 or 3 representatives from your agency and together you make 75% of the meetings, that is sufficient. To review the meeting materials and prepare for votes and discussions, to contribute to the overall mission and specific annual goals. So as we said, the overall mission of the COC is to end homelessness, and that pretty much extends to what we do in CAS as well. And our annual goals sometimes cross from year to year, and we'll go over what our CAS goals are currently in a few minutes. So we have several committees under CAS currently. So our data quality committee reviews they do some of the have some of the responsibility in the point in time count, mostly related to the HMIS or the data system that we use to count our homeless populations. The LSA, longitudinal systems analysis, is a sort of report that has to be submitted to HUD. So they work on that. The housing inventory count, the system performance measures, which are a huge piece. There are 6 system performance measures that we adhere to in the COC that we track and measure and attempt to work on improving. And the data quality team does work on quality improvement projects. The Provider Resource Committee does case studies. They put out the resource guide, and typically they do presentations from provider presentations. The Everyday Connect Committee plans and executes the point in time count, and also plans standardized services for all points of entry. So that includes how any way people come into the system. So it might be 2-in-1 or the drop-in centers. It also might be the soup kitchens, the food pantries, law enforcement, mental health services, all sort of places, the hospitals and healthcare clinics, all of those kinds of places where people may wander into the system. And then they maintain relationships with and provide technical assistance to homeless points of entry. Quick note that we are looking to, within the first quarter of this year, merge the Provider Resource and Everyday Connect committees together. And we're still reviewing a plan for what that will look like. But the goal is to deduplicate some of the work that those committees do. The Veterans Committee maintains a by name list of homeless veterans and case conferences to quickly and safely house veterans and their families. We've discussed other ways of maintaining the Veterans Committee as well recently. Again, there may be changes coming down through the year. The Youth Advocate Committee liaises with school districts and youth providers to address the needs of homeless and at-risk youth. And the Child Care Work Group researches the child care needs of working homeless and at-risk families, proposes solutions, and participates in relevant advocacy efforts. And again, we're looking at merging the Youth Advocate and the Child Care Work Group together sometime probably in this first quarter. So our CAS goals currently are to support families with children. We have individuals who are sort of leading each of these goals. So Jennifer and Monica, who are the chairs of the Youth Advocate Committee and the Child Care Work Group, are leading those initiatives. Goal 2 is to address systemic causes of network impoverishment, homelessness, and recidivism. And Osman, who is the chair of the Fair Housing Committee, which, by the way, is not a COC committee, but a great partner for us, is working on the first part of that, which is reviewing criminalization laws. And the second part is being done by members of our Data Quality Committee, Rob and Ali, who are the chairs of that committee, and Emily, who is a member of that committee, are leading that initiative. So analyzing eviction data is the first step of that. Goal 3 is to improve income outcomes for people experiencing housing crisis. Danielle, Lisa, and Elizabeth have been leading those initiatives. The fourth goal is to increase engagement with key stakeholders, and these stakeholders more specifically are how we engage with sort of gatekeepers to permanent housing solutions. So, for instance, medical forms for Social Security, or the Social Security Administration itself are examples. Goal 5 has been to increase coordination and communication around COBU and other weather-related emergencies. And Maria has been leading that CAS goal team. I believe that that is the end of the orientation. So I'm just going to stop the recording.